Welcome to NAHUC's Virtual Lending Library. NAHUC is a professional association for health unit coordinators and other frontline healthcare professionals performing similar tasks. NAHUC is the provider of professional development for healthcare support team members. NAHUC is pleased to offer the webinar Telehealth as presented by Raquel Alderman of Baptist Health, South Florida. We are grateful to Raquel for providing this content. This presentation first debuted at NAHUC's Education Conference in June 2021. Information about earning NAHUC contact hours through NAHUC's virtual library can be found at the end of this presentation and on the NAHUC website, www.nahuc.org.
It says, on behalf of the National Association of Health Unit Coordinators, we would like to welcome you to our session of Annual Education Conference. This session is about, let me say it right, telehealth. That's a good topic. The future of virtual care. Okay, my name is Sandra Green. Some of you probably already know now. I'm a health unit coordinator at Boca Raton Regional Hospital, which is now owned by Baptist, which is a good thing. Okay, I've been there for 38 years, but I really only been coming to the conference for the last 5 years, and I'm enjoying myself. I don't know about y'all. I'm happy about it. So, what else I have on this paper here? The bathroom. Y'all know what the bathroom is? It's right outside that door. The next thing is I need y'all to turn your cell phones off if they're on. And please don't answer them while we're in our session, okay? And please remember to do your evaluation forms. It's very important to us so we can know, or they can know how to, do their thing the next time. And what else I got to say on this paper here? I need to introduce the speaker. Yeah. Her name is Raquel Edelman. She's so pretty, too. She is the Corporate Sales Account Manager for Baptist Health South Florida. We got a connection. Bringing more than 30 years' experience in sales and marketing to her role, Raquel helps small and large corporations enhance their awareness programs by utilizing the diverse programs, of Baptist Health resources and services. Prior to joining Baptist Health, Raquel was the Director of Marketing, PR, and Communications for HCA Plantation General Hospital. Raquel is a proud FSU alumni, where she received her Bachelor of Science. She has served on their College of Communication and Information and Technology Board since 2017. Though Raquel has lived in Florida, for 40 years, she still considers herself a native of New York, a New Yorker, from Port Chester. Raquel now resides in Parkland, Florida, with two beautiful children, Olivia, 23, and Matthew, 19. Y'all please give a warm welcome to Miss Raquel. I'm done? I think I'm done.
All right.
Thank you.
I know, so nice to meet you. I know. Sorry, we just made
together.
I know, right? Oh, you're welcome. Thank you. So, how is everybody today? I'm really excited to be here because I have to say I have not dressed like this in over a year. Well, I take it back. From here up I have. From here down I have not. So this was like, wow, let me dust these pants off. So I'm really excited to be here, especially a year later. You're surrounded by all of you. I'm really excited to talk to you about our telehealth service. I do want to make this interactive. So if you have any questions during any of the slides, just please raise your hand and we'll stop. I want to make this interactive and make this as fun as we can. So this is our Baptist campus. It is a huge campus. It's like a university. And if you've never been there, it is It's a huge campus. It's beautiful. It's in South Miami and Kendall, for those of you who are from around here. See? Mike. See, I'm hitting the clicker. It's not working. And we tested it too. I like that. I wish you. There we go.
There you are.
Thank you. So just some brief information about Baptist. Baptist has 23,000 employees. We have 11 hospitals in 3 counties. I'm very proud of being a part of the Baptist family, more so because of all, not only what they do for the community and their innovation, but also their recognition for being, by U.S. News and World Report, one of the top hospitals, #1 hospital in Florida, as well as 20 years in a row. This is my favorite one, Fortune 100, top company to work for. And that's really hard nowadays to really, belong to a company where for 20 years in a row, it is the top 100 company people want to work for. So I'm really proud of that. These are the locations of our hospitals. We have 6 in Miami-Dade County, 2 in Monroe, which is the Keys, and then we have 3 new ones in Palm Beach. 1, Boca. We have representation from Boca here. Which is newly acquired, and we have 2 in Boynton Beach, East and West. What did I say?
Bethesda, East and West. You said 2 in Boynton.
Oh, Bethesda, East and West, which is in Boynton. Yeah, I was like, we did Bethesda. Baptist has over 100 outpatient services. So we have locations in the Tri-County area, and we have everything from endoscopy to urgent cares to diagnostic and imaging, and they are throughout the county. And we continue to grow because there's just needs and more for growth in these counties. Baptist is very proud to have 8 centers of excellence. We have for neuroscience, for women in health, for cancer, for cardiac, for sports medicine. This center, you get, in order to get a center of excellence, it's a recognition that you have this basically like an award that you're the excellent at this service. That it's like the most. This is the top hospital for this service. So on to online virtual urgent care. There's so many names for this. It's online virtual urgent care, telehealth, telemedicine. There's just so many names. Our platform is called Care on Demand. So that is what the Baptist platform for online virtual urgent care is. How many people prior to COVID had used virtual care? Show of hands. Like 2. How many people during COVID used it? I don't have to, still some. Okay. Baptist Care on Demand launched in July 2016. The plan was to roll it out as an employer group subscription plan. We would introduce it to small and big businesses and offer online urgent care to their employees. But the employees it'd be free for the employees. It would not need any insurance. There would be no copay and no claims. Currently, everybody, just like myself, you have online urgent care. You have, whether it's through Blue Cross Blue Shield or through United Health, you have your own, but it's through insurance. So that is through insurance. Ours is not. There's no insurance through ours at all. And there's no copay, so there's no cost to the employee whatsoever. The visits are free, and it also includes the employee plus their dependents. So that's the other thing. It includes your dependents. So that's something the other online services do not offer. It's usually just for the employee. We are nationwide. Even though we are based here in South Florida, our service is 24/7 nationwide, all through the U.S. So it doesn't matter where you live. It's virtual. Your prescriptions can still be sent to to wherever you're at. You can be traveling and land, just like if you're here, use the service, and it'll, the GPS, it'll pick up the local pharmacy, and you can go pick it up. There's no bills, there's no copay, there's if you're at home, no driving. And that's the point, there's no bills, there's no copay, it's easy, there's no insurance behind it. And the services obviously are used, and I'm sure everyone now, from COVID, we use it for acute, symptoms, for colds and flus and, pink eye, strep throat, for just minor things. The cost savings, that from using, using the telehealth is outrageous. Many people don't realize that the cost, for emergency room, $150 copay for your urgent care, all those could be avoided, and you can save if you just use a virtual, telehealth. 20% of all the ER visits can be done virtually. I know working at Plantation General, we had people coming in because they had an earache. So imagine spending $150 minimum just for your copay for an earache. So of course at a hospital, even though you say you have an earache, they're going to have to do a CT scan because they're going to make sure it's your head. It's their obligation that they have to make sure it's nothing more. Well, that earache can cost thousands. So that's where the cost and the claims go up. The same with the urgent care, and even if your primary care. And even 24% of your primary care visits could also be avoided. It could be done virtually. And that 20% and 24%, imagine that with the money. I'm sorry, did you raise your hand? I thought I saw someone raise their hand, sorry. So what makes Baptist Health different or makes us unique to everybody else? I call it the secret sauce of Baptist Health. It's the brand awareness. We are local. Our brand, Baptist, as my friend over here was very proud to, now that she's part of the Baptist family, being part of the Baptist system, knowing that when you use our online urgent care, that if you do require to see another physician, you need a cardiologist, you are within the Baptist system. So that's important. It's knowing that we get you to the right site and the right physician that you need to be. If you call your teledoc, your Blue Cross or whoever, you don't know where they're at, where they're from, nothing. Ours, they're actual Baptist practitioners, they're doctors. So that, for some people, I know for myself, it's very reassuring knowing that I'm going to be seeing a Baptist doctor. And then if I need to see somebody in addition, that they will be able to help me or guide me or give me some advice on what physician I should see or specialist I should see. Online urgent care only works, especially in the workplace, if people use it. People will say, well, it's free. We get it for free. Why should people pay? Because that's what the per employee per month is. The employer pays for each employee, let's just say $2. So for $2, the employer, and you have 100 employees, they pay $200 a month for the employees to have this service and their dependents. And you think about $2 per that's like nothing. But the savings is actually having people use it. Because if people are using the online urgent care, what are they not doing? They're not going to the ER and they're not going to the urgent cares. So how do we get people to do that? Because you can have the free service, but even though it's free, if people are not using it, it doesn't matter that it's free. You're not saving any money. That's where we're unique. We actually, 4 times a year, we actually do employee activations. We go on site before COVID, and we've done some virtual. And we go on site and we set up a table and we actually train and communicate with the employees how to use it. Because not everybody knows there's so many apps, how to set it up, how it works. So they need some hands-on. They need somebody to kind of help them, understand how it works, get the code, and so forth. And just telling someone, oh, you have this teledoc free, okay, but maybe I need some help on how to set it up or have some questions. When you're on site, when you're literally with the employee, it's amazing how many will say, oh, I thank you so much. I would have never used this if someone didn't actually, help me. And sometimes it's a language barrier. One of my clients, the Fontainebleau Hotel, you have, of course, the young kids know how to do it, but then you have maybe some older, people who are not as tech savvy and they need some help. or there's a language barrier. So we're hands-on. They're not going to go to HR and say, I don't know how to do this. So that's what makes us unique. We are hands-on, and we do that 4 times a year. We will go on site and we do that. And I think that's important to actually, be present. We also provide all the marketing material to communicate to the employees. I don't believe that any of the other services do that. We provide the e-blast, all the marketing, which I'll show you in a little bit. So the HR or the benefits manager has it and it's already done. I mean, it's a partnership. It's us working with the employer. And the last thing is we provide an ROI report. Obviously, if your employer is going to spend this money, they're going to want to see their return. How am I saving money? What's my return on investment? So this is what the report looks like. Your average utilization rate, and utilization means people who actually use the app, people who are actually using the online version, the virtual urgent care. The average before COVID was 2 to 5%. So 2 to 5% of the people actually, did their doctor visits virtually. During that time, even before COVID, for Baptist Health, we averaged between 10 to 15%, and now as high as 27%. So that means 27% of the people were actually using the online urgent care. Now, what does that mean? I wish I had a pointer. If you see the bar graph, you can see it says you may not be able to. It says employer savings. It'll go by month how much the employer is saving by the employee not going to the ER, the employee not going to an urgent and really encountering unnecessary claims. Because the more claims you do, the more the insurance is going to go up for the employer. So that's what they don't want. And then for the employee savings, it's your money out of pocket. There's no copay. There's no deductible. That's the savings that the employee gets. So, and just remember, this is free for the Baptist Care on Demand. It is free for the employee. So that's the incentive. It's free. You can use it, your family. So we encourage it. This is just a picture. This is when we're on site. That's us setting up, actually in the Fontainebleau underneath. I felt like the Titanic when you're underneath on the bottom of the ship. It was like below. It was like, where are we? Or Disney World, when you're underground. I had no idea. But there was a lot of employees, and we got a lot of people enrolled, and a lot of people. And this is a benefit that they have, and they just need sometimes people face to face to interact and show them. And then on the right side is when we did the virtual. Even though we had COVID, we felt it was necessary that we connect with the employees, and that if they had any questions during COVID, how to utilize the service, this would be the time. I mean, this is something we have committed to, and we want to help the employees with any questions. Our typical user for Care on Demand, obviously, 64% is female. Because no offense to the men in the room, but most of the men they don't even want to go to a doctor, let alone use virtual urgent care. So forget about it. Now they have no excuse. I have no time. I don't want to get in the car. That's urgent care. And the average age, believe it or not, and this is before COVID, I mind you saying, I say that with the ages because I'm sure it's going to change more now, is the millennial age. Like 28% is between 30 to 39. So which is a big chunk. But I can tell you that during COVID, one of the things that I was doing is we were calling people when they used our service to see how it was and see their experience. And a lot of people who were, let's say, in the 50 and above, they would have never used it before. And so I think that those numbers are going to start growing as people are more comfortable and start utilizing it. These are just some of our partners. These are some of our Care on Demand partners that we have. We have Fontainebleau, we have Berkowitz, we have Bermeo. Recently, we just signed with Altice and Ultra. They're the Altman Group. They are actually a developer. These are apartment complexes. So we thought, what a great way for residents when they move in as part of an amenity to have this service free for the residents. You have your gym, you have your pool, you have all this amenity. Why not give the residents, the peace of mind of knowing that they have this, virtual urgent care that they can use anytime. They don't need to leave at 2 a.m, that they have it. And the average cost is $20 to $32 per person a year. That's not much when you think about if you ever rent an apartment that they charge you $50 to take out the garbage a month, or all the other charges. And this is actually your health. So I think it's great that these developers want to ensure that the residents have a healthy environment that they can live in, especially if you have kids. Imagine, looking for an apartment and this one actually has free virtual urgent care. So that's one of the other online urgent cares that we have. I was telling you, for the employers, for the 100 and more. We also have employers who have employees 100 and less. When we first started, it was for big companies, people who had 100, 200, 300. As I was going to chambers, we had local businesses who were saying, wow, this is a great product, but I only have 30 employees. I only have 15 employees. And do you have something for me? And the model wasn't really set up for that, but we should. That's one thing about Baptists. We're very proud to be a part of the community and do everything we can to help the community and create programs and give them resources. Well, this is a resource that they need. So we created the online wellness program. It's $59 per employee for the year. So for $59 for the whole year, the employee, they don't pay anything, the employer pays that. They get four visits a year for free. And they get to use all the services, and they get free flu shots. They get all the same services as anybody else, but they pay nothing. And those are for groups of 10 or more. And I mean, the businesses just loved it because sometimes they can't offer insurance, but they could afford this. This is a great alternative to the other insurances. So I thought I'd share with you a graph of when Care on Demand, when we started, you can see year one where we're at. 2 guesses when COVID hit. So as you can see, we were gradually, year 2. Year 3 was probably when I came on toward the end of year 3, we were trying to introducing. And I remember when I first started, and they told me about it, this is great. I can't wait to roll this out. And some people were not very familiar with it. And then COVID hits. Well, now I knew everyone's going to know how to do this, use this now. And look at that peak. I mean, that changed obviously because we were, everyone for health reasons told not to go to an ER or an urgent care. But you are also forced now to use virtual, urgent care. We actually opened it up through, I think, the end of July, and it was free for everybody, the community. We told the media, it was open. Like, anyone just use it. So I thought this graph was interesting. So what it shows here is, I wish I had a little pointer. I'll go over here. So this was before COVID, and obviously, this is your ER and your urgent care. Everyone's always using it. And of course, little old Care on Demand is not used very actually. Then all of a sudden, COVID starts to hit. And as the visits starting to go down, these start to go up. And this is worth me. And now, as we get into a new normal, yes, this will start to go up. The ER will start to go up, but it will not be where it was before. We truly believe, and this is obviously, we truly believe people will not be going to the ER, not just obviously for the convenience and the cost, but why expose yourself, regardless of COVID, to be around in an area that you don't need to, and for what expense? And the urgent care is, yes, I can see people still utilizing that, and we may not be here, but we'll definitely be growing, and it'll still be growth there with that. So, survey says, so people were asked, how has COVID changed the outlook of telehealth? So in 2019, before COVID, 11% of the consumers used telehealth, virtual urgent care. Now, since COVID, and how many are going to use it going forward? 76% now will be using it. 76. That's a huge jump. I'm excited because I don't know people really understand that just means if people can really, utilize the product the way it should be, you're going to be saving, ourselves so much money because these insurance companies, they just keep going up and up. I don't know about you guys, but every year for open enrollment for us, my cost out of my paycheck for my medical is going up. And then unless things are covered. That's what the insurance companies do. They have to make the money somewhere. And I was explaining to my daughter who's 23 and learning about insurance and how that works. And I said, think of it like when you have car insurance. You don't want any claims, because if you have claims, you're costing the insurance too much, and it's going to go up. So you don't want to do a claim for $200. So you don't want to go to an ER or an urgent care if you don't need to. It's costing the insurance company thousands of dollars for something that could be done for no minimal amount of money. So I thought I'd share with you, I was telling you about the communication that we do, the marketing when you're a Care on Demand member with the employers. I just wanted to share with you, this is what we use, English and Spanish, let me go back. So this is important because they have a special service key. Here's an example. This service key is what this village, John Knox Village, one of our clients and their dependents, and they just put in that code, and they don't have to worry about ever, having to pay for it. And this is just an email that goes out, and we create this for them. We create this for the employer, and this is great. They don't have to do anything. The HR and the benefits, they just love us. They're like, this is great. So I think it's important that we create this, and then we have it in Spanish. So I have a video, so you guys, I wanted to share with you the marketing that we have on social media. We just started it recently just to get people to understand really why you should use Care on Demand. Didn't do it, so I'm gonna have to touch it, right, Mike?
Thankfully, Baptist Health is here, because even superheroes need care sometimes.
Oh, quick. So cute. So obviously if someone has a cough, you're not going to go to an urgent care. So it's just, obviously, now it does that. So during the pandemic, we partnered with a company called Tydo we wanted to enhance the visit, because you have everyone at home with a pandemic, and we wanted how do we get people to utilize, their time with the doctor to really provide them all the information that they need. Let's say they have an earache. So let me go to the next one. We have this digital health kit, which I brought mine, which is wonderful. Basically, this is used during your visit. So let's just say you have an earache and you go to the doctor. I'm going to put this here, hold on. I'm actually going to go here. So you're with the doctor and you say, I have an earache. So what this does is it takes a video and the doctor can see inside your ear. So imagine when you're with your child and your child's like, oh, my ear, or even a 2-month-old, a 3-month-old, and you don't know. But the doctor, of course, what does a doctor, when you go to a doctor's office, they check your ear, they'll check your heart. So this is basically, checking all the vitals. But you get to control it because you're home. You can't go out. So how am I going to provide this to the doctor? You want to make sure that you give the doctor as much information as possible. So this is so cute. So you have the different categories. So let's just say, where's the ear? There's the ear. Well, this is for the heart. And it'll tell you which one to use. So let's do that one. So let's say you have a cough. So it'll tell you, okay, put that on, and you put it on. And then, it's got to be quiet in the rooms because it's going to be taking your, listening either to your heart or, for this case, your lungs. You have a cough. You have your mother who's really sick. You want to make sure she doesn't have pneumonia. You don't want to take her out. Well, now you can measure this. The doctor can hear if there's actual fluid and can actually say, yes, she has pneumonia. I'm going to, call in a prescription. Or, nope, you need to take her to the ER. So this actually does all the vitals that a doctor needs. It'll listen to the heart, listen to your lungs, listen to your, look inside your ear, look down your throat. Let me turn this on. Your throat. My daughter, I can tell you during COVID how many times she had strep throat. But let's say you're little, you don't know. the doctor can see down the throat and say, oh yes, you have an infection. So this we were selling, in which I have a flyer here. And I think this is great. I have one. A lot of my friends like travel with it, just in case someone's sick. And even if you don't use a telehealth and you just want to check, you have this. The days of just having a thermometer. I mean, this is, it just puts you at ease knowing that the doctor has all the information. You don't have to use Care on Demand to do this. You can have your own. You can do this and then send it to your doctor, your pediatrician or your personal doctor, because it saves it. So this is a great record, it'll save it. So I have a flyer there with the information, but the beauty of it, it's $270, and you can use your flexible spending or your HSA dollars, which a lot of people utilize that when they're like, I have extra money. This is a great tool to have, especially at home. I highly recommend it. These are just how it works for your ear infection, congestions. Again, it's being able to take control and being able to, monitor your whatever's wrong. Oh, the video's not in there. Okay. We put in this kit when we launched. We partnered with a developer, Cocadina, and they loved it so much that for their new homes, they were giving each homeowner, they were including that in the home as a gift. So in each home, every homeowner received this. They wanted to also ensure that they had a healthy home. They wanted to ensure that all their home buyers had one of these kits and that they were, they knew that they wanted their new homeowners to be healthy. So here's the video on this one.
Can getting better get better? What if your doctor's office visited you? That's better. What if you could get a doctor's advice instead of opinions from the internet? Yeah, that's better. What if your intuition became a doctor's diagnosis? Now that's better. With TytoCare, you can get a full medical checkup with your vital data from anywhere. Now you won't have to spend half your life waiting in waiting rooms. Isn't that better? TytoCare, getting better just got better.
So that's the kit and the flyer that I have up there that we're promoting. We have it also on our website. So where we're going into somewhat of the future, Baptist had a lot of on-site clinics and a lot of big corporations, but due to COVID, we had to shut it down. So we again partnered with Tyto and looking into having maybe a virtual on-site clinic. So similar to your visit that you'd have on your phone, you have an iPad, you have a private little room, you have a setup, you have an iPad, and you have the same little devices of the digital health kit. And this way your employer or your employee, if they're at work, after COVID, they can go into this room and they can visit with a doctor and, be able to be seen, get their prescription, and not have to worry about leaving work or getting exposed, going to a doctor's office. It was a way for a lot of companies to be able to afford something like this versus having an on-site clinic. On-site clinics cost a lot because you have to have a doctor or a PA. This cut it in more than even half. So it allowed the employer to, kind of show to the employees, look, we want to make sure that you have a safe and healthy work environment. This is how we're going to invest in, in you, and they would create, they would get this on-site clinic in a private room and they can see a doctor. I mean, how great, you're not feeling well, you can go into this room, see a doctor, and then get your prescription. So it's about convenience, but it's also about, peace of mind, knowing that if you are not feeling well at work, there's a place for you to go. So that's something we're working on in the future. That's our next exciting launch. So the other thing, what's next? So we believe in digital first. So digital first is where you should start. Your visits should start digitally. So the Baptist wants to pilot a program within Care on Demand that basically it'll facilitate for the patient. So imagine you do a visit on Care on Demand, and the doctor's like, you know what, you strep test, you have strep throat. You need to go get a strep test because obviously you can't get it done virtually. The doctor will then call the Express Care Center for you and make the appointment, already have the labs or have the evaluation already done for you, set up for you. So imagine getting off the phone, and if you need to have an x-ray or if you need to get a pregnancy test, the doctor will set it up with one of our Express centers. So when you leave there, or you say in 2 days, it's already set up. We're trying to ensure that all your needs that you have are served within Baptist. Keep it easy, because of course if you have your visit and the doctor says, oh, you need to get an x-ray. Okay, now where do you go? You got to call. You know all the steps, what a pain it is. But imagine if the doctor does it for you. Yes, you need to have an x-ray. I will schedule it for you. And we're doing it just with our Express centers, which I think there's like 4 of them. So imagine that peace of mind that your doctor is handling this. Well, I would like to see this go eventually. That's just one step. Imagine seeing the doctor and saying, you know what, you need to see a cardiologist. You're using that monitor, you need to see a cardiologist. Let me set up an appointment for you. You need to make things easier for somebody, because the minute you hang up with them, do you know if they're going to see a cardiologist? Do they know a cardiologist off the top? So again, that's where we want to make sure that even though it begins digitally, it'll end up in person, but it needs to start digitally, and let that be the first point of contact, and then we guide you. We need to make sure that your healthcare needs get served within Baptist, and that we help you, guide you. Because when you're like, oh, I got to get this lab, I got to get this done, but imagine if someone does that for you. And it's the convenience. So that's what we're going to be piloting. So yes, virtual growth is real. It's the visits, let me go over here. I said before. This is like 2025, this is where we're at now. As the virtual visits go up, you're going to see the physical visits, they're just going to start declining more and more. But you're going to see more and more of the virtual visits, going up and up. So, which is great, because that's just a lot of savings. But I think people are now taking more control of their health now. They're more aware, if anything, than they were before. The pandemic did that, which is great. So yes, the growth is not going to slow down. It's definitely going to increase. So I told you about the online urgent care for the employer that has over 100 employees, has under 100 employees for your little locals, and also the residential for the apartments. Now we also have the consumers. Everybody, the consumers out there. So I put on there, I have a discount card for you guys there. We offer Care on Demand for $59. That's how much it is, whether or not anyone could utilize Care on Demand. It's $59, no insurance, nothing. You can use it anytime. So we, decided to do a discount just for you guys. So I have some cards here for you guys to try it. So it's $30 off your visit. So we also do a lot of promoting our consumer online urgent care as well, to get people to use it who just want to use it and their employer doesn't have it. So if you guys have your phones, I put the QR code up there, because if you want to download the app, or you can just scan, because I know me, I've never done so much QR codes in restaurants than ever before. So I said, we got to have a QR code, because everyone now knows what a QR code, how to use it. Before you didn't. You have to, So I encourage you guys to download it. So one of my favorite innovator and favorite places to go is Walt Disney. And I thought this was just so apropos about the future. To be successful, you must be unique. You must be so different that if people want what you have, they must come to you to get it. And that, to me, definitely defines Baptist. They want to be unique. And you're right, if you want to be successful, if you want to be unique, you need to have something that nobody else has, and that they want to come to you. And that is where they they're innovative in creating things that nobody else, is doing. So I thought that was just apropos on this subject. And that's it. Thank you. Yes. No.
Thank you for watching this webinar. Please follow the instructions on the screen to earn NAHUC contact hours. You may visit our website, look for education, click on virtual library to access the post-test and instructions. Please call or text or email with any questions that you may have. Our contact information is listed on this slide.